Of all the sports where rhabdomyolysis has occurred, one sport usually gets a pass, and that is swimming. But has rhabdo occurred in swimmers? The answer is actually yes. Let's look at the reports, see what we can make of them, draw some conclusions, and try to reduce the risk of rhabdo happening in swimmers in the future. Here's a report of a 32-year-old man who goes to the hospital with complaints of body aches and dizziness and headaches that occurred several days after he was swimming laps in a pool. He also reports having similar symptoms a month prior when he was swimming, and that incident occurred after several years after he had done any kind of swimming at all. They also report that this guy was not a novice, rather he was working out in a gym several days a week, performing both aerobic and strength training workouts. Yet even though he was working out on the land on a regular basis, he presented to the hospital with a creatine kinase level of over 100,000, and he had dark colored urine as well. Fortunately, this was said to be a somewhat innocuous case of rhabdomyolysis. He was sent home, told to rest and hydrate, and after about a week his symptoms and creatine kinase levels went back to normal. There's also this report of rhabdo occurring in a teenager who we're told is also an elite water polo athlete. We're also told the teenager had a mutation in the IL-6 gene, which can increase the production of a pro-inflammatory compound called interleukin-6. And this mutation is also associated with a greater risk of getting rhabdo. However, the title of this paper is a little misleading because it gives the impression that this teenager developed rhabdo while doing water polo, but that's not what happened. Even though this teenager was an elite water polo athlete, he developed rhabdo after 2 days of military service training. This case reminds me of the incident that occurred at Tufts University, where several members of their soccer team developed rhabdo after doing a Navy SEAL type workout. Regardless, the teenager eventually recovers, returns to water polo, and has no further incidents. In this next report, 7 Division I college swimmers developed rhabdomyolysis, including swelling and dark colored urine. If we phrase this a different way, rhabdo occurred in 17% of the total 41 swimmers that were involved in this incident. And by the way, these swimmers claimed to be well hydrated, which casts doubt on the common belief in the fitness world that simply drinking water will prevent rhabdo. So what triggered the rhabdo in this incident? Well, it doesn't appear to be the swimming. Rather, it seems to be related to the pre-season workout these swimmers took part in. That workout included push-ups, bodyweight squats, and maximum pull-ups. As you can see in this table, in the 3 days where rhabdo was presenting itself in these swimmers, those exercises that were being performed seemed to be somewhat different than what these swimmers were doing a week prior. For example, in the week before all this happened, there were no bodyweight squats. On day 2 of this incident, there was a typical weightlifting circuit, but I don't see a circuit listed in any of their prior trainings. That brings us to this report of 34 college Division I swimmers who took part in an intense arm workout competition. That competition consisted of pull-ups, bench presses, and rows. In the end, 13 out of 34 swimmers, about 40%, developed rhabdo. 6 of those swimmers, about 17%, required hospitalization, but fortunately, none of them needed dialysis. And here is a case of massive rhabdomyolysis and organ failure resulting from a bacterial infection in a 63-year-old man who was swimming in Hawaii. The symptoms this guy experienced didn't seem to occur until at least 3 weeks after he returned from vacation. Obviously, this case of rhabdo didn't occur from swimming per se, but rather a bacterial infection. Still, it is a cautionary tale to be mindful of where you swim. So what conclusions can we draw from this? Well, based on the reports that I was able to uncover, compared to other sports like football, the incidence of rhabdo in swimmers appears to be pretty low. However, when rhabdo occurs, it seems to follow doing unaccustomed, unfamiliar types of workouts and movement patterns. Even in highly trained athletes, performing unaccustomed, unfamiliar, repetitive movement patterns and exercises seems to be the precipitating incident. So for the coaches who are watching me, I think the solution is clear. To reduce the risk of rhabdo in your athletes, progress your athletes slowly. Don't introduce high volume, unfamiliar, repetitive workouts in the preseason workouts if those workouts deviate significantly from what your athletes were doing in the off season.